Good evening, everyone. My name is Anthony Owens, and I'm standing for the candidacy of the Reform Party in the constituency of Northampton South. A little bit about myself. I'm a former soldier. I'm also a former police officer. I served during the 1990s and into the 2000s. Now, I work as a paramedic within a GP practice. I guess you could say I've spent my whole entire career serving the community. I've witnessed the struggles people have every day. This ethos has been passed on to my family. My son is currently serving in the British Forces, and my wife is a senior nurse in the NHS. It is the reason why I'm standing today. I'm determined to bring about change that you, as the constituents, need. And I think, for me, one of the pressing issues is our dire healthcare. We have a waiting list of 7.5 million outstanding cases. 3.23 million of those cases are waiting more than 18 weeks. 309,000 referrals are waiting over a year. We are not meeting our cancer targets. And that's because we have no capacity in hospital. Only last week, an acutely ill patient came to our surgery. Even though we tried our best to save his life, he died at the surgery because there's no capacity in hospital. The truth is, GP referrals are being rejected. We have a tired and overworked NHS staff. GP numbers have fallen from 29,000 to 27,000 in the last 2 years. GP nursing numbers have reduced, with ongoing staff retirement and resignations only exacerbating the problem. To be honest, there is no incentive to stay in the NHS. We also have something called the Integrated Care Boards. They are compounding the punitive measures on the GP surgeries. For example, we have a good GP surgery, and it provides good quality of care to patients. And it says, we're now getting too many patients, we want to close our list. The ICBs are putting and penalising those surgeries, so those surgeries don't close their lists, and they take tens, hundreds, and then thousands more patients, and the quality of care reduces. In the end, those surgeries get rated as inadequate, and worst case scenario, they close. And guess what happens? Those thousands of patients have to go and find another GP surgery, thus increasing the burden on the NHS. Surgeries are no longer able to eat the demand. The truth is, Labour wants surgeries to stay open and longer. They want us open at weekends. Where will the staff come to do that? The real key is retaining the staff that we've got at the moment. The NHS as a whole costs us £171 billion. Waiting times in A&E for longer than 12 hours is 95% higher than it was in 2019. 1.6 million patients wait longer than 4 hours in A&E. Truthfully, the service has become target and budget driven. Honestly, it's a postcode lottery. There are too many layers of staff within the NHS, particularly non-clinical staff. If I told you that there are 60,000 non-clinical managers within the NHS earning more than £100,000, I ask you, what do you want? Do you want non-clinical managers, or do you want more doctors, nurses, paramedics, allied healthcare professionals? We have a shortage of 11,000 doctors. There are 1 in 10 nursing roles available, and overall there's 125 nursing vacancies. Labour's plan is to create 2 million extra appointments, scans and operations in the first year. I ask you, even if they got the equipment available, where would those staff come to do those extra appointments, scans and operations? The truth is, Labour's saying it's going to pay more money for overtime. Do you know the current bill for overtime in the NHS is £10.4 billion? And it's those same staff that are overworked and tired working those extra hours. The Conservatives plan to throw more money at the NHS, but as I've always pointed out, it's not money. That is not the answer. The Conservatives have said they want to reform the NHS, but they haven't provided us with any plan. Reform Party is the only party with a plan for the NHS. Zero-based rate income tax for frontline NHS staff for the next 3 years. We'll retain the staff that we've got. And I know from speaking to my colleagues that have recently left the service, it will attract them back. Now, we do need to rely on non-profit organisations and private sector to help us. We are going to provide a 20% tax relief for those who seek private health care, because we know that those who can afford to pay more will alleviate the stress and pressure on the NHS, so that those that can't afford to pay more still get the service that they need. We also are talking about students and training. Student fees pro rata will be written off for doctors, nurses and all medical staff in the next 10 years, and I know that will increase our staffing numbers. I would like to talk to you all about something very personal to me, COVID and the pandemic. I was a paramedic on the front line for the whole of the 2 years of the COVID pandemic. When it started in the early part of March 2020, for the first 6 weeks we had no PPE, that's personal protective equipment. Every day I would go out in my ambulance with my crewmate to patients, knowing that we were spreading the virus. When that equipment did arrive, those masks didn't fit. Those gowns were unfit for use. Have you ever thought about watching a patient die because they can't breathe? The impact on mental and physical health of the NHS staff was incredible. And all the time now we know the Conservatives lined their pockets at the expense of public health. The total cost for PPE stands at the moment at £10.4 billion. We have weekly costs of £7 million. To find out that those contracts that were awarded to those VIP lanes without scrutiny or transparency. We know that companies like Yaanda were awarded £252 million for unfit face masks. MedPro, £203 million was awarded. And we know that Baroness Moan personally pocketed to the tune of £27 million. The Conservatives and Labour governments exploited this for gain. They risked public safety. They risked your safety. They risked my safety, and they risked my family's safety. And we still don't know, with our current Prime Minister, Rishi Sunak, how many shares he has in Moderna and how much profit he's made from that. And on top of that, recently we've got the blood bank scandal. From the 1970s to the 1990s, contaminated blood was given to patients. Approximately 30,000 victims. Over 2,000 of them have died, unfortunately, from contaminated blood through HIV, hepatitis C, and associated illnesses. During the 70s and 80s, this was covered up, and it was only from the news journalists who revealed the evidence. Then in the Archer inquiry from 1991 to 1993 revealed the evidence. Since then, there have been 2 Conservative and 1 Labour governments that have failed to act. Not only has this led to devastated families, but this is also communities torn apart. When the second inquiry started in 2017, the victims and families have still fought for justice, and it has been painfully slow. Finally, this year, the inquiry revealed the failings of the NHS, the Department of Health, but most important, of our governments, Labour and Conservative. It reports reckless disregard for patient safety. This is a stain on every government that allowed this to happen. In conclusion, the Conservatives have no plans and no solutions for the NHS. Labour policies are unattainable and not realistic. We have record waiting lists, staffing crisis, ambulance and A&E in crisis, and this will only lead to more deaths. I joined the NHS to be a paramedic, to save lives. If I'm elected, I will be a voice for every patient throughout the UK. The Reform Party is the only party with achievable goals. It's a bold plan for a bold party. Vote for reform. Thank you.